Do you think you have shingles?
Or maybe varicella-zoster.
Yeah, shingles sounds like something you put on your roof. It is definitely not. It is something that happens to your skin, and it is horribly painful.
Okay, so
what is it?
Shingles is the sequelae of a virus.
Yes.
Okay. Now, in life, we get viral infections, and
a little while ago we had a big one.
Yeah, that took over the whole world. And with many viruses, once you have them, they stay in your body forever.
Right.
Okay. Particularly this family of herpes types virus.
Right.
That lives in your body forever, and then when your immune system is just a little bit compromised, it comes back to haunt you.
So what is the virus that causes shingles?
The varicella-zoster virus causes shingles. And now those of you who have been reading pediatric textbooks recently might recognize that's the virus that causes chickenpox.
Or if you're our generation, you may have partaken in a chickenpox party.
Really?
Yeah, so back in the day, definitely in the 70s, I remember this. Chickenpox is so contagious.
Yes.
So if you had like 4 or 5 kids and your kids hung out with other kids, rather than each one getting it for like 2 weeks and then another one getting it for 2 weeks, you'd actually potentially, wasn't recommended against because you still could have complications. You'd have a party where all the kids would just get chickenpox and just one and done.
Yeah. But since we're not in the 1700s anymore.
No, 1970s.
Oh, I thought you said 1700s. Now, basically, we get a vaccine, right?
Right.
There's a vaccine for
kids
chickenpox.
Get vaccine,
because chickenpox is not benign in kids. Most of the time it is, but sometimes you can have complications.
And it's also not benign in pregnant moms because that can cause severe complications, even death in unborn babies.
That's right. You can get the chickenpox virus in like the brain tissues, and it can be very dangerous.
Yes.
That's another video on chickenpox. We don't want to get everyone in a panic about chickenpox. However, this is the sequelae of that infection.
Right.
So you had it a long time. It's like a cold sore, right?
Yes.
People have cold sores. That's the same family of virus. That virus lives in your body, and then when you're immune compromised, like when you have a cold or something, that virus comes back again.
Right.
On your lip.
And so the way that it works is once that virus causes the chickenpox, it goes and hides in something called your dorsal root ganglion. So these are little areas of your peripheral nervous system just outside your spinal cord. We have 31 pairs of spinal nerves, and it sits in this little ganglion and then gets reintroduced, typically for a host of reasons, but often related to stress.
Yeah, exactly. Stress and different things that will cause your immune system to be compromised to a certain degree, and then it comes up again. Okay, so how common is this shingles? Like 1 in a million, 1 in 100,000?
So it's pretty common. It's estimated to be 2 to 9 per 1,000 people.
That's fairly common.
It is. So most people know someone that's had shingles.
Yeah. And now some of the risk factors, you're like, oh my God, am I at risk for this? Well, if you're an advanced age, maybe. Decreased immunity, like we mentioned.
Yep. And that could be something as severe as HIV or AIDS, or even something less severe like asthma, COPD, rheumatoid arthritis.
Yeah, so something that's decreasing your immunity, some stress that you might be having.
Yep.
Stress can also decrease your immunity, so chill out.
Yeah.
And family history.
Yeah, so if someone in your family's had shingles, you're at a higher chance of getting shingles.
Yeah, so you're like, oh my God, Mom, you've got shingles. And your mom's like, oh, don't worry so much about me. And it's like, no, it just means I'm going to get it.
I'm worried about me, I'm not worried about you.
Don't do that to your mom.
And this video came out of a personal because my wife currently is battling shingles.
That's where this video came from.
Right.
Truth be told, full disclosure, we are being sponsored now by Dr. Wiening's wife.
Yes. So we can talk a little bit about how it happened because I think this is a common problem that people have because the early parts of shingles are not obvious. They're not clear. So often before you get a rash, there are very vague symptoms like pain in your abdomen. You generally feel unwell. You can have headaches and photophobia. And the way that it works when we talked about how that little virus goes along the nerve endings, it usually stays in a very specific area called a dermatome. So dermatomes are nerves that feed a dermatome is the area that a nerve feeds a specific sensation. So around your stomach is something called T10, or your 10th thoracic nerve feeds around your belly button. And the interesting thing about shingles is that it usually involves 1, typically, but sometimes up to 2 or 3 dermatomes, and usually does not cross the midline, so it stays on one side.
Because your nerves come out on each side.
Right, so my wife had pain on her right side, kind of her right upper and lower quadrant, some of it radiating into the back, because the dermatome goes around to the back as well. But generally felt unwell, so we thought, well, maybe it's appendicitis, maybe it's cholecystitis. We didn't know, maybe it was just a low back strain. A lot of people think, oh, I just worked out too hard and I have a sore back. After 4 days though, and the pain didn't go away, we actually went to the hospital and actually had investigations, had an ultrasound to rule out gallbladder disease, had blood work, had urinalysis, and it was all normal, and it was a bit of an enigma. And interestingly, the very first day she had pain, the one thing she said that rung true to me was that the skin was very sensitive. And usually if you have a problem deep inside your abdomen, the skin's not superficially sensitive. I said, well, maybe it's shingles, but I didn't see the rash. And I didn't know as much about the pre-rash kind of stuff. So I did plant the seed of shingles.
But still fooled the doctor.
Fooled the doctor, fooled all of the doctors.
So that's just it. The symptoms are vague, and that's typical of many viral illnesses, right? You know, before you get a cold or before you get sick, you get these generalized malaise, aches and pains, the light hurts. Those are the kind of vague viral symptoms that you can tell your body's fighting something going on. And it's the same thing with this recurrence of this virus that's in your body that's about to cause shingles.
Right, so it causes this rash that then erupts on the skin and causes what are called vesicles. They're little fluid-filled sacs.
I call them vesicles.
Vesicles or vesicles, yeah, it depends, I guess. Potato, potato.
You say vesicle, I say vesicle. No.
Right, and the rash slowly starts to spread, and it spreads even over 3 and 4 days. It continued to get larger every day. The vesicles, or vesicles, they rupture and release this fluid. And this is the time actually when shingles is contagious. So, important note, you cannot give someone shingles.
No, you can't give someone shingles from your shingles, but you can give someone who has not had chickenpox before chickenpox from your shingles, the fluid or inhaling the particles, that kind of stuff.
So that's why you should keep it covered, and also particularly on people that are immunocompromised. So they recommend that anyone that's immunocompromised, you should not be exposed to those people. So pregnant women, newborn babies, and generally compromised.
And you can't give shingles to someone if you have shingles, because you're not going to get shingles on your first infection with this virus. Like we said, first you get the chickenpox, the same idea, it affects the skin with a little bit of a rash, but that's more generalized. So you're going to have that chickenpox virus living in your nerves, and then they're going to come out and manifest as shingles, as we talked about. So you're not going to catch shingles from someone who has shingles.
Okay, so now we're to the point, now you got shingles.
Has anyone not had chickenpox? I mean, you just leave a comment if you've never had chickenpox or the vaccine. I'm pretty sure everyone has
I bet our demographic has all had chickenpox is my guess, and some of them are going to have had shingles for sure.
Yeah, for sure. But I bet you, we should look this up, but what the incidence is of chickenpox.
It was an optional vaccine, I think, for kids.
There is a vaccine now,
so kids but not everybody has to get it. It's not mandatory.
No.
Okay, so now you got shingles, you got a rash. Is there a cure? So the spoiler alert is that there's no cure for this.
And that's in keeping with just about any viral illness.
You got to ride it out.
There's no cure for the vast majority of viral illnesses. We can suppress the virus, control the symptoms, maybe even make its manifestation in your body a bit shorter with different medications, but there's no cure for this viral illness or most viral illnesses.
Right, so what do you do? So first let's talk about the rash itself. So you should keep it clean. So they recommend things like cold or even lukewarm baths. Don't do a hot bath. That actually is going to be hard on your skin. It's probably going to be more painful. Dry it off. Some people cover it with a barrier like petroleum jelly, and then a non-adherent pad to keep it covered. So that's the rash part.
Yeah, and you don't want to get a secondary bacterial infection from that rash, like a cellulitis or something like that, right?
Right.
So keep that rash clean and dry as much as possible, and avoid hot water, because your skin is very sensitive. Because remember, this is coming down the nerve.
Yes.
Coming down the pipe of the nerve. So,
and that's why you get that nerve pain. Some people say tingly pain. Sometimes it's fiery burning. Sometimes it's like electrical shock. And that's all because it's primarily coming from the nerve.
Right.
Okay, so now we've talked about the rash. Second thing, is there anything that you should do for the virus itself?
There are some antiviral medications that can control the virus. They're not 100%. A cure. They won't kill the virus completely, but they can try and control it. And those are usually the meds that end in ovir.
Right, so acyclovir, famciclovir, and valciclovir. The purpose of these is to reduce the duration of your disease, as well as it's been shown to reduce the risk of complications. The one important thing to note is that once you do get diagnosed with shingles, it's time sensitive. So they estimate 48 to 72 hours. So the sooner you start it after you get the rash, the higher the chances that it's going to help.
Yeah, if you already got the full-blown rash, the ship is almost sailed.
Yes, you got to get there quickly.
Yeah.
Okay.
Time.
Yes.
Time is probably the most important treatment. You need to give it time to run its course, okay?
Yeah.
Remember, viruses over humans, viruses win. So you just got to let the thing run its course, and then hopefully you're okay after that.
Right. But now you say, well, what am I going to do about all this pain, doc? I have lots of it. So we have some options for you.
Yeah, there are the obvious things that you could take, like over the counter, like an acetaminophen, or just a regular analgesics. That's an option for you. You can treat it locally with some lidocaine, which is just a numbing agent, right, to numb the pain, give you a few hours of relief. Calamine lotion is often talked about. Cold compresses are often talked about. Just topical things you can do on the rash to try and control the pain.
Prescription medications like anticonvulsants like gabapentin, antidepressants like amitriptyline, those both have been effective to really reduce that nerve pain, which is, we've talked about this before, where medications are designed for one thing and then a secondary benefit is identified in the kind of post-analysis.
Yeah, and time, like we said, just
time.
wait it out.
Okay, so are there any complications from getting shingles? Or once you get it, are you done with it and then you don't have to worry about it?
Most of the time, yes.
Thankfully,
okay,
yes.
yeah, but like anything in life, there are complications. And like we said, once you have a skin rash, you've lost that barrier to infection.
Yep.
So you can get an infection. Now we're not talking about another viral infection, but a secondary bacterial infection that can affect the skin and causes cellulitis.
Yep, that's definitely one of the complications. The second one that's really quite common is something called post-herpetic neuralgia, where your nerves stay persistently painful. Sometimes this is weeks, sometimes this is months, sometimes this is years, and sometimes for the older you get, the higher the chances it can be permanent. And this occurs in 10 to 18% of the people, so not an insignificant group of people.
Yeah, the nerves just get damaged, inflamed, and they just become hypersensitive forever. Another complication that can happen occurs if you get the shingles near an eye.
The shingles, yeah.
Shingles near the eye.
Yeah, it's called herpes-zoster ophthalmicus.
You can actually lose your vision if that happens.
Yeah. And that's an emergency, so if it's around your eye, you gotta see your doctor fast.
Yeah, but that is thankfully rare as well.
And then the last one would be something called disseminated zoster, where essentially the virus kind of goes everywhere, attacks you kind of generally speaking, and 1 to 4% of these people end up hospitalized, and actually can be quite serious.
And that's not very common either. Thankfully. However, that does happen to people who are severely immune compromised, whether you're on medications to suppress your immune system, if you're battling an autoimmune disease, or if you have an uncontrolled HIV or some other virus that's affecting your immune system severely.
Okay, so now that everyone's really, really afraid, they just don't want to leave their house now because they don't want to get shingles, is there anything to do to reduce their chance of getting shingles?
Actually, there is a vaccine for it right now.
Please don't get mad. Please don't get mad about the vaccine.
There is. I mean, there's a vaccine to prevent shingles now, and it's usually indicated, I think, I mean, you usually, in our region, I don't think you're qualified to get the vaccine until you're over 50, I believe.
I think you qualify over 50, and I think it's paid for by the government over 65.
Yeah, so in our area. But that's something to consider.
I will tell you, I am on the phone to my family doctor as soon as their office opens today to discuss that, because we just finished the long weekend, so we haven't had a chance. And I also suspect that Hamza, the guy that helps us with all of our editing, he had shingles last year, and he would tell you, go get the vaccine, because it is very, very painful.
Yeah, definitely. So that's the good news, right? We always like to end on a good note.
Yes, and then with the good news. But
we're not promoting it. No. We're not sponsored by the vaccine people, and I don't even know what company makes it, but I'm just saying I haven't had mine yet.
No, honestly, I'm going to get mine soon.
Have you had chickenpox?
Yes.
Have you had shingles?
No, that's why I'm going to get the vaccine. And I think once you've had shingles, I still think there may be potential benefit for the vaccine even after that, which is a bit odd.
Because remember, you can get it again.
That's right.
Less likely, but you can get it again.
And just hang in there, because often shingles takes 4 to 6 weeks. This is not a short thing. It's not a 3 to 5 day. It's not a 48-hour flu. Like this hangs on for a while. So hang in there.
Yeah.
Now you're armed with all the information of what to do to try to get through it a little bit better.
Yeah.
And if you like this video, please like it, subscribe to our channel, share it with someone that you think might get shingles.
And depending on how long this video ends up being, you may only have to watch it 400 times, and then your shingles will be gone.
Sure.
Remember, you are in charge of your own health.
We'll see you next time.